It worked.
I'm really glad you made it too. Otherwise, these poor people were just been looking at me, staring at them, pretending
You could have done like
for like.
stand-up routine, like practiced your jokes.
Thanks
Maybe I shouldn't have joined.
so much for coming on. I was telling
Yeah.
my patients this week. I don't know when the last time I like just called like a doctor was, and then ended up talking to them for like 40 minutes. Like, you're so cool. We were like, we should just recorded that. It was
I know. Well, we got to beat that this time. So like 41 minutes or nothing in my
right.
book. Strap in, people. Let's go.
So,
How's your day been?
what's that?
How's your day been?
It's good. We're starting to kind of get back a little bit to normal. We're still seeing new patients and everything. So we're taking a day off tomorrow though. We got a short week, so we're going into the weekend strong over here at Kinetic.
Good.
How about you? Tell me about the new practice. How's everything going?
It's awesome. I'm exhausted in a good way. Like we just launched this program called the 21-day restart, and it's just combining like nutrition and naturopathic medicine and personal training and all at like an entry price point for people. And so it's been a great way for people to get their feet wet and start to learn about how to use food as medicine. Like, and we can drill into that a little bit later, but just like the fact that there's 72 nutrients we never talk about. Like most times you see in the nutritionist, it's like protein, fat, carbs, be on your way.
Exactly.
And we're going to get into like potassium and magnesium and calcium and do the thing. So it's been fun, but it's been a long week. So
can you give everyone watching like a little bit of like intro on yourself? So what it is you do?
Yeah, absolutely. So I'm a naturopathic doctor, which means that my training was similar to an MD or DO for the first 2 years of school, where we got all of our anatomy, physiology, gross lab, biochemistry. And then it differed a little bit in the last couple of years of school, where your traditional MD or DO will do a lot of pharmacy, minor surgery, emergency medicine. We do a lot of botanical medicine, counseling, nutrition, physical medicine. In the sense, like in states other than Pennsylvania, because Pennsylvania is a bit weird, but in Washington State where I trained, it's very similar to chiropractic adjustments.
Okay.
So I can put somebody's ribs back or, fix their neck. So it's designed to be more preventive and holistic. And I think that's a gap that everybody agrees could be filled in, our medical system right now. Like we need more people to sit down and talk to you about, okay, you have diabetes. How do you eat to not only manage it, but if it's type 2 diabetes, to reverse it? And that type of medicine takes time that the traditional docs don't have. You might have 5 or 10 minutes with them, and that's all your insurance covers. So we're kind of supposed to be the solution to that moving forward. Yeah.
Great. And we kind of talked about that a little bit before. It's just kind of the nature of the system. It's like when you're in this system, you don't get a lot of time with patients, right? That's just kind of how it is. It's not anyone's fault. It's not like no one wants to spend time with people, but that's just kind of the system you have to work in, in this country. But what's awesome about your practice, right, is you're seeing people for longer than they've ever been seen ever. Like you're seeing like an hour and a half, correct?
Yeah,
Right.
the first time. Well, and like I've already looked over all their intake paperwork too. So generally, a lot of people find it therapeutic because there's a section where it's like, tell me your life timeline from birth until now. And some people just do like, I was born, I got asthma when I was 6, and now I'm like overweight. Do with that what you will. Others are like, on my first day of birth, I should inhale oxygen. And so I know them pretty well by the time they walk in the door. So it's even like it starts before they even come in.
Right.
And then in general, like I'm following up with people for about a half hour at least, like for free during the week. Because with individualized medicine, and you know this too, you can prescribe like the best treatment that you feel based on the first time you meet someone, but there's always tweaks. And that's part of why our type of medicine is so relational, because you need them to come back and say, like, these 5 things you did were great. I'm not going to do this 6th thing ever.
Right.
And so we need to find something else. Yeah.
That's very true. And I feel like, just like you said, that kind of time and kind of that problem solving is something that you don't find a lot of places. It's easier in professions like yours and like PT, where I see people a lot, right? There's just the amount of time I'm with them is different. So when someone comes in and says, or I'll give you a perfect example, is sometimes we have older clients that come in and they're dealing with maybe dementia or something similar, right? But I see them enough that I'm like, okay, this is not your baseline. This is probably more of like a delirious episode or something that if you saw them for a snapshot in time, you wouldn't recognize that, right?
Right.
But that
Yep.
comes with spending time with people, which is hard to do in the regular system.
Yeah. Yeah.
So it's great. So can you explain a little bit about, so if someone comes to your practice, well, I guess first, who do you find yourself seeing so far since you opened in February here? And then how does it go? Like, what are people coming to you for routinely?
I tend to see people who they've kind of tried everything in the traditional system and they still need more. So whether it's like somebody who has anxiety, they tried the pills, it didn't work. They went to a nutritionist, it wasn't a good fit, and they're struggling. Like they know they need to improve their diet, but they don't know how, or they know they need to exercise, but it just never quite works out. Somebody who's had chronic Lyme and hasn't been able to find a doctor who really like is well versed in helping them fix what's called like their terrain. So basically just the health of their whole system so that their immune system works better. People that just generally feel left out. And I will say, like, we're in Pennsylvania. I feel like we are really like do-it-yourselfers in this state. We tend to be tough people. Like we don't pull punches. Yeah. Yeah. So like it tends to be those type of people too who are like, I want to actually fix this. Like I don't want a pill, which again, like I'm trained in pharmacy too. Like I in Washington State, like a lot of what I did was prescribing if people needed it. So I'm familiar with the benefits that pharmaceuticals can have, but the people who come to me typically don't want to be on them or they want to minimize the amount that they're on. And then they're ready to do the work, like they're ready to change their diet, they're ready to start cooking different foods and
Right.
meditating sometimes.
So that brings me, man, I'm pushing meditation all the time. I'm serious. It's like, it's hard because people, I don't know, just going down this road, there's kind of like a woo aspect,
Yeah.
right? And, it's hard also. So like, I'll give some like an app, which is kind of difficult to do. And then they'll like start it and they'll be like, I don't know, I can't do this. And it's kind of like anything else. I kind of tell them the benefit is in like the practice of doing it. It's not like you do it and then you're like, done, now I'm at peace, right? No, that's not how it is, right? It's the practice of doing everything. And we've been lucky enough to hook up with a great mindfulness practitioner, Debbie Early, and her company as well. She's helped us out a lot with that, much more so than because you get kind of that personal attention. But talking about Pennsylvania, you're from here, right?
I am. I'm from Coatesville.
Okay, but you're in Washington for school. How is it being back?
Awesome. Awesome.
Yeah.
I missed my family. Like I was gone for so long, I feel like. And then, like I said, people are just very tough here and they tell it like it is. And I missed that so much. Also, the summers here are so beautiful.
Yeah. Yeah.
And it doesn't rain as much.
Like, just like constant rain. You're probably like, your vitamin D levels are off the charts. You're just like glowing all the time.
I don't have to take vitamin D anymore. It's amazing. Like there's sun. It's such a relief. I'm saving like $10 a month. It's great.
That's awesome. I
Yeah.
know awesome recently. So getting back to how you got into this kind of field, you kind of have a special kind of story. I heard you kind of telling it on Mark's show. Can you kind of recap a little bit, like how you ended up kind of going down this path?
Absolutely, yeah. So I had celiac disease, which for people who don't know is an autoimmune reaction to gluten, which is a major component of wheat. It's a protein in wheat. And I wasn't diagnosed for 21 years. So the first 21 years of my life were kind of rough. Like I had stomach aches all the time. I just didn't feel well. And it's just, I was eating something I was allergic to like 3 to 5 times a day. Like every time I ate my cereal in the morning, I was making myself sicker and I just didn't know. So, and what's funny was I got a lot of really good care. Like I was the kid with stomach aches who went to CHOP, Children's Hospital of Philadelphia, and like they kind of would patch me up and send me home and be like, I don't know what's really wrong with you. Maybe you should try therapy, which I did, but it like didn't fix my stomach aches for obvious reasons. So I got a really good window into what we do really well in like traditional medicine. And it's full of like these really caring, smart, awesome doctors who do exactly what they're trained to do. Like if you are in a car accident or you're in the emergency room, like you want to be in the United States because we're awesome. But like this sort of chronic stuff, like we're not as well equipped to handle and fix. And so it took me till I was in college and I got hooked up with a functional medicine practitioner that, I pretty much walked in the door and they were like, oh, you probably have celiac. They tested me, and then literally 3 days after taking gluten out of my diet, I was like a whole new person.
Right.
Which is like, I mean, people might be familiar. Do you remember Survivor,
Of course.
the show? Remember Elizabeth Hasselbeck? Like, she was the one who, she was on Survivor. They put them on this island. They can't eat, right? They're like eating leaves.
Right.
And she was like, I feel great.
Right.
Like, I feel better than I normally feel. And someone was like, you have celiac. That's why, because you're no longer eating like cereal and bread every day that made you sick. So that was kind of my story. And for me, it was so powerful because those first 21 years of my life, it was such a struggle, but I had a lot of shame just because I was like, what's wrong with me? Why am I not like a normal kid that can go to a pizza party and like not have to go to sleep afterwards?
Right.
So yeah, so it was like that just dropped away. And when I didn't have the health problems holding me back, I just took off and I felt like, oh, this can't just be my story. Like there have to be more people out there who have these issues. And it was really just basic nutrition, right? But most doctors get an hour of nutrition in med school. So it took me finding somebody who deliberately sought out more education in nutrition for them to recognize it. And this was like 10 years ago, so doctors are a little more hip to celiac now, and they screen for it.
Right.
But I wanted to go to med school where I would learn that from the beginning. Like I would learn nutrition from day one. So that's why I chose to go into naturopathic medicine.
Of course. And I feel like, especially when it comes to, people that have gone through the health system and they see, one doctor, then two doctors, then three doctors, and without an answer, just like you said, like it took you that long to figure out that is what I have going, right? And so you kind of lost in the system a little bit, and then you almost kind of get, you're defeated. You're like, well, this is just how I am.
Yep.
I can't change it. I don't know why. Just keep living my life. And then all of a sudden, boom, it's like that you find someone or something, and you're like, oh, what? This the whole time I had no idea, right? And it changes your life, right? Which is huge. You know what I mean? And I feel like there's so many people, just who I see, who are always dealing with these tiny things. Like it's not that's like stopping them from living their life, but it's not like how it should be. And then, you can't help but think, okay, like you treat these injuries, I'll treat whatever orthopedic thing they have going on or help with whatever neuro thing they have going on. And then it gets better, but then something else pops up and you can't help but think, okay, there's got to be some type of underlying issue here that we just don't see.
Yep.
Right? It happens all the time.
Yeah. Right? Well, I meant to ask you, like, what's your story? What made you go into PT?
So it's not like glamorous. It's not like the most glamorous. I'll be honest with you. It's like a pretty lame PT story. I knew I wanted to do something in medicine, and my parents were like, "What do you want to do, Gabe?" And I was like, "I don't know." And they were like, "Well, my parents are great." They were like, "Okay, well, here's 3 things we think you would like." Because parents go like, look
best.
Yeah, exactly. What awesome parents.
Yeah.
And like PT was like one of those things.
Yeah.
And I went and like shadowed and hung out. And like, yeah, I want to do this. And I was like in high school, and then I just did it. And now I'm a PT. And but I love it. I mean, it's like it worked out perfectly because
it's like you got a doctorate. Like you don't just do, just for the audience, like people who are listening, it's like 10 years of your life. Yeah. Okay, like oh my god.
But it was awesome. Like I loved it. And I tell people all the time, like I had equally as much fun in like grad school as I did in undergrad. Like I loved undergrad, but I loved PT school. I mean, I was also in like Washington D.C. I went to GW, so I was in like cool city too. Right. So there was other like perks to it, but like and I feel like that's how it should be when you're doing something you like really like. You know.
Yeah.
It's different than just studying whatever.
Yeah.
The point A to B, right? But yeah, it was great. And then after that, I worked in DC for a little bit, and then I came back here I'm from Pennsylvania as well. I don't know if we talked about that.
Yeah.
Yeah, luckily,
Yeah.
we ended up moving back like a year and a half ago and taking this job at our Westchester clinic. So it's been great. But part of the reason I took this kind of job is I get to do stuff like this, right? I get to like connect with people, and
Yeah.
I mean, we're a team. That healthcare is supposed to be a team, and it's oftentimes very fragmented. You know, you try and break down that barrier as much as you can. But people like you who just hop on my Instagram here and just like hang out. Yeah, exactly. You make it easy, right? So,
Well, I think, oh, go ahead. What were you going to say?
no, go ahead.
Well, I was going to say, I think we both connected about this when we talked. I think it was last week that like the smartest people we know reach across the aisle. Like they're always kind of part of some kind of integrative team because nobody knows it all. And we all got excellent training in our thing.
Right.
But there's always something more. And like because people have such holistic problems, you know, you need kind of everybody to pitch in at some point. So I'm always referring to PT. Like I was so grateful to connect with you because I always need, like I would say half the people I work with, some kind of ache or pain. You know, like they walk in and I'm looking at their gait and or the way that they walk and I'm thinking, you know, like somebody needs to help them with that, you know, and like for so many people in America, chronic pain is such a big issue right now. And I think the power of physical therapy and physical medicine and training, people don't realize how much they can heal themselves if they just focus on making, you know, the weaker muscles stronger. And like you guys are like magicians to
Right.
me.
Agree.
Yeah.
Well, I appreciate that. Thank you. It's the same thing on your end. Whenever we're trying to help someone do something, you know, if you can optimize how somebody's body just heals itself,
Yep.
it makes everything so much easier. You know, you can equate it to like smoking. Everyone agrees now, you know, if you smoke, it's not good. Your body, you feel the effects of that. You don't heal well, right? And so everyone agrees with that. But just like you said, there are other these factors. You were eating something that was inflaming you every day. Just didn't know.
Whoops.
Right.
Yeah. Yeah. Well, and people don't know, like, it kind of, your nutrition plays such a big role in healing from a physical injury, too. Like, our collagen is made up of nutrients, right? Like vitamin C and copper. Like, you need those nutrients to build new collagen. And so when you have a surgery or when you're recovering,
Right.
you know, I need you guys to give my patients the exercises that they need to get better, but then it's my job to make sure that they're actually intaking the nutrients that they need to let the healing happen.
Right.
So kind of like superhuman when you have everybody on your team helping you
Agreed.
heal. Yeah.
So how does it work? If someone like comes in to see you, what kind of things can they like expect? Like what kind of tests do you start with? What do you usually look for?
It depends. So what I do with people the first visit is we go through their intake, and the intake is long because it's like head to toe, birth till now. I want to know every symptom you've got going on. I want to know your story, anything you've been diagnosed with, what kind of workup you've had, who you've seen, what results you've gotten. So it's a lot of getting to know the person. And then we go through their diet, and we'll either do a 1 day intake or we'll look at 3 full days. And I break down their diet and we start to see what they are getting. And I love for people to bring in blood work if they've already got it, but we'll run blood work, like I'll check thyroid or vitamin D or things that I can tell from the intake.
Mm-hmm.
Like I want to make sure are healthy and not off. And then we go through like a really intense nutrition part of the visit where we talk about here's what you're getting in your diet. I think that based on your symptoms and your lab work, you know, you probably need a little more B12 or folate. And here are your options for getting it. We can have you eat these couple foods more regularly, or you can take a supplement and we'll problem solve because everybody's different. Some people are like, yes, I'll eat beef liver. Let's go. And some people are like, absolutely. If it's not a gummy, I won't do it. You know, and like, that's great. All of those are great. I just need to know. So we problem solve a lot. And then they leave with a really holistic plan. And I talk about nutrition a lot because, I mean, that's a lot of what people come to me in Pennsylvania for. But a lot of times we'll end up doing a mindfulness piece as well. And I'll start connecting them with other people in the community if I feel like they need more help. So I'll refer them to PT.
Right.
And for me, like my training is in biofeedback. So I have a particular approach to mindfulness that some people don't. And mine is all about helping people what's called orient in safety. So for some people, they sit down to meditate and they can't do it. And they're like, either because like, like, is it too boring or am I just lazy? And the answer is not, no, that's not why. A lot of times for people, that sitting down and calming down the nervous system activates some kind of like response for them where they have fight or flight or they shut down. And so my job is to help people come back to like a really healthy nervous system regulation. And so we use gadgets and we hook people up to all these monitors and look at like their heart rate and their breath rate and their sweat rate. And it's fun, you know?
No, that's really cool. I
Yeah.
did not know about using the biofeedback for meditation. That's so cool. When you can look at something like that and
Yeah.
like get on a screen and kind of like change it helps so much. Helps so
Well,
much.
it's much more data driven. It doesn't feel so like fluffy and weird. I think a lot of people think of meditation as like not being science based or data driven. They think of it as like something you do when you're a hippie. And
Right.
I mean, it is, but like it's also, you can watch your heart rate change, right? Like
Yeah.
you can show people, look at the heart rate you came in with, watch your heart rate when you're talking about your pain. And for a lot of people, their heart rate goes up to 90 or 100 because they start holding their breath, they start tensing,
Yep.
they get anxious. And then I help them bring their heart rate down with their breath. And we check their pain level, and their pain level might have dropped in half just from breathing.
Right.
And it's like, that's free. That's
Right.
free. If it were a pill, it would be illegal not to prescribe it. It's so effective. And so it's very scientific, and people just want to see the data. They don't like, part of what I love about my medicine is, but people are highly intelligent. They come in, they've already done all their internet research. Like they're capable of understanding things at a really high level. Like they just need the doctor to take the time to explain it.
Right.
So you hook somebody up to all these monitors and they can actually watch what's going on in their body. There's no way they're not going to walk away feeling like more empowered.
Right. Yeah, that mind-body connection is huge. And that reminds me, like, only a few weeks ago, my boss actually recommended a pre-workout, like a new pre-workout, which is like, if people don't know, it's like something you take before you work out. So it like, one of the things it does is it gives you a lot of like energy because there's crazy stuff in it. So he was like, try this. And I haven't taken a pre-workout since like college. And I was like, okay. So I was taking it for like a week or two. And I took it one day later in the day. And I was like laying in bed hours later, like that night. And I was just like feeling like not right. I was like trying to go to sleep. And I'm like, man, I do not feel good. And I'm just like taking my pulse. And I can like feel like my heart just like in straight arrhythmia, like not working. Right.
Oh my God.
But just like my heart like skipping a beat and going a little bit faster than normal, that made me feel anxious for no reason.
Yep.
Now I'm just laying there feeling anxious, and I'm like, what? And I'm aware enough that I'm like, why am I? I'm just trying to go to sleep, right? And it was just because of my heart rate, right?
Yeah.
And some people live their whole lives like that.
Most people don't hold their breath. They're holding their breath all the time. You can see it. And it's not until you point it out to someone, help them learn to breathe, that they're like, oh, I didn't realize I like routinely clench my jaw and, like, I'm like this all day.
Right.
And that's a lot of stress on your body.
Oh,
okay. Next time you get pre-workout, just send me a picture of the label.
Okay.
And I'll be like, yeah, your name.
Like,
yeah.
Now I'm going to be like embarrassed too. I stopped taking it. I don't want to do it. I don't want to like.
Don't be embarrassed. You have me in your corner. Just send it to me.
Right.
I'll tell you yes or no.
Okay. I actually will. I'm curious. I want to see what you started a nonprofit, right?
I did. We probably should talk about this in like a month because I just had a session on it and like I got advice. We're gonna have to pivot it. But the idea behind it is that good medicine comes from everybody, right? Like it comes from me, it comes from you, but evidence-based medicine is everywhere. And I developed this idea because after meeting with pharmacists and farmers and grandmothers and midwives, everybody had something to teach and everybody had something to bring to the table. I mean, you probably know this, like you spend 2 hours with a parent of a child with autism, like you're going to learn more than we learned in graduate school, probably, about helping a kid with autism.
Right.
And so I wanted to honor the fact that expertise comes from everywhere. And we just need to start to give people the tools to evaluate it. And so that was the idea, is that there's this framework where we can bring everybody to the table. And so instead of like, somebody sitting at home on the computer and typing in like, why do I have headaches? and they get like three different chat rooms, and like they're feeling lost.
Yep.
I want one place for people to go where they can hear from everybody, like me, you, like a surgeon, acupuncturist, and like a naturalist who's out in the wild and has learned about traditional uses of herbs. Like there's something that's going to work for everybody will pop up in that conversation.
Right.
And I think now's the time because with the internet, we have the ability to do it. And if we don't organize ourselves a little bit more, people are just feeling really lost.
Yeah, totally agree.
Yeah.
That
Yeah.
that's really cool. And I feel like I don't know why it is. I don't know why. I mean, maybe you can give me your opinion. Why is it so hard to do that? Even for me, because when you're doing it for long enough, right? You can't help. It's really hard to not be defensive sometimes when you are talking to or discussing things with other practitioners. I don't know if it's just regular like human nature, but you can't help but kind of be a little bit selfish. I think everyone kind of that like, oh well, you don't know what I know, and that person's like, well, I understand, but you don't know what I know.
Right.
And, right. It kind of turns into this. I mean, that's just human nature, I guess. But it's so hard to do. It's hard to do everywhere, but especially too in medicine when you have so many different practitioners and places to go and access to these different places of care. It's hard. Like you really have to kind of be selfless, and you have to do it all the time, and it's hard to do. It's like really hard to do.
That's why I feel like my story, I think, is what made me want to do this because I had access to all the top docs and they were great. And like the fact that they didn't know my thing didn't mean there was anything wrong with them.
Right.
It just meant I needed more options. And so for me, like it's still easy for me to tap into that place of like being a patient who was really confused. And so I can be an advocate in that way. But it's hard because you have to drop your ego. And like we went to school where we had all these tests. Like I felt like every single day, and maybe you did too. I had a test, and it was like right, wrong, yes, no, like you're either good or you're not. And it really like it can be really hard on the ego, and it makes you want to study your butt off and be better like than you ever thought you could and be infallible. Like there's this myth in medicine that we're supposed to know everything, be perfect.
Right.
And like I just feel like I'm tired of playing that game. Like we have the internet. Think about how many thousands of papers are being published every day on PubMed. No doctor can keep up with all of that. Like we need all of us.
Right.
I don't have the time. Like I do my thing in my corner of the world.
Right.
But like I want to be able to drop the ego and this facade of like being the only source of information and just sit at a table with people and say, how do we really help people? Right. And I've been humbled enough, and I'm sure you have too, where like we thought we had the answer. And then somebody goes to like a different practitioner and they're like, oh, this guy, like I remember one patient, that one person I knew, they had stomach aches forever. I was treating them in my own way. Yeah, they got a little bit better. And then it turned out they had like an impinged nerve that was just like radiating pain because it was connected to like their celiac ganglion. Anyway, it was their spine.
Right.
And I didn't think of it.
Right.
You have to be kidding me. So there are some doctors who would be defensive, right? Or like go into shame mode or, just like to decide to be better. And to me, my practice is always to just get curious and to just build relationships because it's way more fun. Like this is so much more fun, like getting to connect with really smart people.
So much more.
Yeah, and like build teams. And I really feel like the doctors who don't do this are going to become dinosaurs soon.
Yeah. And that goes to the same thing when you're, just like you said, when you're building that relationship with your patient. A lot of times I'll have a patient come in and we'll go through the initial, evaluation. And I don't know exactly what's going on. And it's okay for me to say that. Tell them that. Like when you're honest with them, I'll be like, hey, listen, this is kind of weird. I think this. But also this, we're going to figure it out together. Yep. Like when you tell someone that instead of saying, this is what you have to do this and X, Y, and Z. Just like you said, being curious about it, and we're like, let's figure this out together. People are so much more receptive to that. And it just makes you feel like, okay, this guy's like on my side.
Yeah. Right? Yeah. Well, I think we were both talking when we talked the first time about StoryBrand and just like the way that we have both decided to operate our clinics is around patient outcomes, which in like layman's terms basically means, are people getting better or are they not?
Right.
And what drives us both is the story. So this person came in, they were suffering, they left, they feel better, they're now more empowered in doing what they want to do in the world. And when you're a practitioner who's focused on story and success and getting people the best results, like you being the only resource just doesn't even matter. Like you want to get everybody on board who can help them
Right.
because it's just about them succeeding. So, I feel like more and more like there are like-minded practitioners like this out there, and we, as long as you know, we're able to get the best results for people. So,
Right.
Yeah.
Agreed. You're right. More fun.
Yeah.
Yeah.
Yes.
So your practice is in Exton, correct?
It is. Yeah, I'm right across the street from Lineville Natural Pharmacy.
Okay, great. So for everyone watching, like if they want to get in touch with you, how can they reach out?
They can just go to my website. So it's just www.drkatehenry.com. And I do something called a discovery call with people. So it's a free 15-minute call where we just chat and we get to know each other. And people can kind of tell me their story, tell me what they're looking for, and I can let them know if I think I can help them and how. And
Okay.
I find that it's a really it's a nice way for people to get to know me and, like they don't feel any obligation. So that's generally what I recommend people do first.
Awesome.
And then how about you guys?
Yeah, so we just opened up our Westchester clinic again. I was in Chester Springs for a while. We're back.
Hey.
So it's going well. If anyone has any problems or anything, they can always reach out through our website, kineticptpa.com. You can email me specifically, Gabe K at kineticptpa.com. Or you can always reach out through Instagram, Facebook, whatever kind of social media. I'll see it, or one of our other practitioners will see it, and we'll be able to reach out for sure. But thank you so much for coming on today. This was great.
Thanks for having me. Let's do it again.
For
This was
sure.
fun.
Good luck with everything with the practice going forward. You're going to get like a huge influx of Gabe told me to come here people.
Likewise. Yeah, likewise. Yeah, we'll probably end up talking a lot more because of that, right?
I know.
Yeah.
Sure, 100%.
Okay.
Right, thank you so much.
Yeah, have a great weekend.
You too. Take care.
Thanks. Bye.